The figures released by the NCDC as at the 1st of June 2020 indicates that the number of confirmed cases of COVID-19 has risen to over 10,000. And this goes to show that we are not out of the blues yet, and as such, Nigerians should not become complacent, and they should continue to adhere and comply with measures already instituted by the federal government to curtail the spread of this virus. I am Dr. Igenigbai Cyprian, and welcome to Inside Health. The COVID-19 virus was discovered late last year in a province in China. It is said to have originated from wild animals. However, it is capable of person-to-person spread. This virus is highly contagious and is rapidly fatal in individuals who show severe symptoms, and as such is an issue of public health importance. For this reason, it has been tagged a pandemic by the World Health Organization. So how do we get these viruses? COVID-19 is a respiratory illness, meaning it affects the respiratory tract, and the seat of infection is usually the lungs, which is in the lower respiratory tract. And this infection can be spread from contact with droplets released by infected individuals. These droplets or secretions can be released during talking, during coughing, or sneezing. And you can get it directly if these droplets lands on any of the mucous membranes surrounding the orifices or openings into the face. These openings include the mouth, the nose, and the eyes. The mucous membrane is this slimy layer that you see lining these openings. So when this virus in the droplets gets deposited in these mucous membranes, it can be taken in and it can get infected. Also, you can get infected indirectly by coming in contact with surfaces aboard these organisms. For example, an infected person sneezes and these droplets settle on the surface like a table, and you touch this table and use the unwashed hand to touch any of these parts of the body, your eye, your nose, or your mouth, you can get infected. So how do we prevent ourselves from getting infected? These measures I'm going to be talking about is not new. I'm just going to reiterate it so that Nigerians will continue doing the good job they've been doing. First of all, we have to practice social distancing. If you have no business leaving your house, stay indoors. Avoid contact with sick people, even in the house, and always wear your protective face coverings if you must go out. And in social distancing, it is advocated that you stay at least 2 meters from any individual, as if you must go outside. This 2 meters is not arbitrary. It is born from the fact that studies have shown that these droplets released from the respiratory tract when we sneeze, cough, or talk typically do not travel more than 2 meters. So if you stay 2 meters away from an infected person and he coughs or sneezes, you are unlikely to get infected. Another way of preventing infection is to practice respiratory or cough hygiene. When you want to cough, you cover your mouth with the inside of your elbow, or you use a clean tissue or handkerchief, you cough into it and discard it. You don't have to be squeezing this material. If you do that, you are getting more contact with the virus, so you discard immediately. Then you wash your hands with soap under running water for at least 20 seconds. When you don't have soap and there is no obvious dirt on your hands, you can use an alcohol-based sanitizer. And the alcohol content should be between 60 to 70%. Also, the idea of washing your hands for at least 20 seconds is not arbitrary. By the composition of soap, it has the ability to penetrate the cell membranes of microorganisms. So 20 minutes, 20 seconds allows you enough contact between the soap and these viruses, and ultimately leading to their destruction. So we can also use our face mask as stated earlier on. During this program, I would like to demonstrate to us the proper way to wash our hands, because I have observed that a lot of Nigerians do not understand the proper way to wash our hands. First of all, we'll get water on our hands. We can open the tap. Since most of our taps in Nigeria are hand operated, so you open the tap, you get water on your hands, you apply your soap, and you lather the soap. Don't forget to wash the web spaces. You can do these movements to wash in between the fingers. You can wash in between the thumb by making these movements. All right? And there's an area that most of us forget to wash, and this part of the hand comes in contact with our faces a lot. This is this portion of the hands. This is where we use most times to clean our eyes, our nose, and mouth. And most times we forget to wash it. So always pay attention to this area and wash it. You can also scrub your palm. At the same time, you're washing the nail, critical where you can harbor organisms, as we all know. Thereafter, you dry your hands with a clean tissue, and you use that tissue to close the tap to avoid recontaminating your hands. Then you discard this tissue paper. So if you think you've been exposed to this virus, perhaps you've come in contact with an individual that you suspect might be harboring this virus, or you have some symptoms, do not panic. Remain in your house, maintain social distancing, wear your protective mask, and call the toll-free number released by NCDC. This is Inside Health. See you next time.